Assalamu alaikum. Good afternoon to everyone. Welcome to our Population Health and Wellbeing series. And if you recall, in this series, we try and accomplish three objectives. One is to talk about the contemporary and critical topics relevant to healthcare and population health. Number two, we examine evidence-based practices germane to population health and healthcare. And three, we describe opportunities and challenges in the evolving phase of healthcare and population health. So before I introduce our esteemed speaker for today, let me just quickly go over a few housekeeping notes. Your cameras and microphones are turned off. Use the Q&A feature to type questions and any comments that you might have. Questions will be addressed at the end of the session, and that session will be coordinated by Dr. Suhaila Chima, who's Assistant Dean in the Institute for Population Health. As a reminder, this activity is accredited by Accreditation Council for Continuing Medical Education in the US, and also by the Ministry of Public Health, its Department of Healthcare Professions. So the post-activity evaluation will be available in your Cloud CME by January 24th, 2021. You will receive an email notification once the evaluation is available in your Cloud CME account. And you know this, it's a reminder from last session. Your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So today's topic is a look back and lessons moving forward, 4 decades of experience in medical education. And to present that topic, we have with us Dr. William Pinsky. Dr. William Pinsky is the President and Chief Executive Officer of the ECFMG, and many of you have heard of ECFMG, and the Board Chair Foundation for Advancement of International Medical Education and Research, also called FAIMER in the US. He is distinguished, world-renowned in the field of medical and health education. He is a terrific leader and advancing the agenda of global medical education worldwide. Prior to joining ECFMG in mid-2016, Dr. Pinsky was Executive Vice President and Chief Academic Officer of Ochsner Health Systems, OHS. He also served as the Executive Vice President for Ochsner International and Professor and Head of the Ochsner Clinical School, a United States partner of the University of Queensland School of Medicine in Australia. Dr. Pinsky retains honorary professorship at the University of Queensland in Australia. Dr. Pinsky graduated from St. Louis University School of Medicine and trained at the famous Baylor College of Medicine and Texas Children's Hospital. Before joining OHS, Dr. Pinsky held a number of senior academic and senior positions at Wayne State University School of Medicine in Detroit and at the Detroit Medical Center. Dr. Pinsky has served on boards for the Accreditation Council of Graduate Medical Education, the Accreditation Council for Continuing Medical Education, and the Alliance for Independent Academic Medical Centers, where he also served as the president. Dr. Pinsky is a fellow of the American Academy of Pediatrics, the American College of Cardiology, and the American College of Chest Physicians. His most recent honors include the Leadership Award for the Faculty of Medicine and Biological Sciences presented by the University of Queensland in 2015, and the Founders Award presented by the American Academy of Pediatrics in 2013. I've known Dr. Pinsky for a few years. He's a great colleague, a great friend, and he may not know this, but he's been my mentor. Every time I have a question or an issue surrounding medical education, I reach out to Bill, and he's always gracious to respond to all the difficult problems and questions we present to him. I am so honored that we have with us Bill. I know, Bill, how difficult it must be taking the time out of your busy schedule, but we are truly grateful to you. Our gratitude to you for taking the time out of your busy schedule to be with us this evening. So with that, may I invite Dr. Pinsky. Bill, over to you, please. Thank you so much.
Yeah, thank you, Ravi. That was over the top introduction. I feel so. I very much appreciate it, and in fact, the honor is mine to be with you all today. I am in New Orleans, and it's early in the morning here, and so it's a great time before I get into all of my work. So just give me a second to get my screen shared. As I was saying, I really appreciate the invitation for today, and what I really mostly appreciate is the wonderful friendship that we have, that really began when I began my position at ECFMG 4.5 years ago. It's just been a wonderful experience knowing everybody in Doha. I've enjoyed my visits there, and I would very much rather be doing this in person in Doha than being here in New Orleans. And so we're all hopeful for the vaccination and other public health measures to help us get through the pandemic. So I excuse me, have no financial relationships to disclose. I'm not talking about any drugs or products, mostly because I really don't know anything anymore about current drugs or products. So I can't be guilty on that part. I thought, to really would be really important perhaps would be to share my experiences, really my career experiences. I've been very fortunate to have a very, very long and productive career, and I definitely have learned some things on the way. And if I could just share a few of those with you today, and how I got to where I am, and if it is helpful at all to people who are attending this symposium today, it would be very worthwhile. Whether no matter what stage you are in your career, I think there's always you have to be able to look for possibilities, and I'm sure that those attending today, run the whole gamut of ages and positions. And then I'm going to pivot near the end and talk about really where my career has brought me, which is to the accreditation and impact on global medical education, and what that means to the public in assuring them that they have appropriate caregivers. So, Dr. Montami talked somewhat in terms of the roles that I've had, and I'm going to sort of run through a chronology for you as well as a map. And there's really two takeaways that I'd like you to make from my comments. One is that one's career is always evolving, and it is, no matter how planned out someone thinks they are in terms of what they're going to be doing, you really never know where you'll end up. And it's very important to be able to be flexible and at times allow your career to take you where it wants to. So very simply, when I started my career, my goals were to lead a large academic pediatric cardiology division. if you were to ask me what I wanted to be, or what I wanted my career to be as I was growing up, if you talked to me when I was 13 years old, I would have told you I wanted to be a race car driver. Now, as far-fetched as that sounds, as I talked with you today, I almost made it, or I made it to a certain point, but that's something else that we'll get into later in the talk. And while my career goal was to lead a large academic pediatric cardiology program, as I enter or continue this last phase, that's not where I am today. Where I am today is I'm leading an organization that really is at the forefront of improving global medical education and healthcare. So I did achieve the part in terms of achieving, of leading a large academic pediatric cardiology program, and then I've moved on. And just to maybe perhaps take a little sidebar here and just remind everybody that ECFMG FAIMER is a nonprofit, non-governmental organization. We're based in Philadelphia, and we work to promote quality medical education and healthcare worldwide. We're recognized as experts on world's medical education systems and their graduates. We're recognized with our intellectual property and being able to authenticate physician credentials, assessment of physicians, and we also do research, particularly on the migration of physicians across borders, with probably a pretty heavy emphasis on US physician workforce issues, but we also deal with the same type of issues around the world. So this is how my professional life has evolved. So this is a very strange map on this slide. I've got sort of 2/3 of the United States, and then there's this island off here in the Atlantic, which is really a continent in the Pacific that I'm sure you all recognize as Australia. But for the purposes of our discussion, we've taken the liberty to bring this all together. So started off in Akron, Ohio. That's where I was raised. Akron is in northeastern Ohio, near Cleveland, probably. Many of you know Cleveland, particularly at Cleveland Clinic. And I graduated from University of Akron. And from Akron, I went to medical school over here in St. Louis, Missouri, which is almost in the middle of the country. And I'll say in a few minutes how important it is that I went to St. Louis University in terms of how that shaped my career as well. When I graduated from St. Louis University, as Dr. Montami mentioned, my wife and I moved to Houston, Texas, to begin my pediatric residency at the Baylor College of Medicine and Texas Children's Hospital. At this point, I already knew that I wanted to be a pediatric cardiologist because of a mentor and experiences back here in St. Louis. And I specifically chose Baylor College of Medicine, Texas Children's Hospital for my pediatric residency because I knew of their very strong pediatric cardiology program. I was fortunate when I finished my fellowship to be asked to stay on as an assistant professor in the department. And a few years later, a few of us together allowed ourselves to be recruited to the University of Nebraska, to the medical center there, and to be in the pediatric cardiology program there. I'm not sure if anybody in the audience has ever been to Nebraska, but it probably has the worst weather in the entire country. So when the wind starts blowing way up here in the North Pole, there's really nothing between the North Pole and Omaha. So it's incredibly cold in the winter. And the summers are very hot and humid, probably not as hot as Doha, but very hot and high humidity. So has all of the worst characteristics. After being in Nebraska for a few years and establishing my academic career, I was asked to be head of pediatric cardiology program down here in New Orleans. And this was our first move to New Orleans, where I became associate professor of pediatrics and head of the pediatric cardiology program at Tulane University Medical Center. And so this was my first opportunity to lead a pediatric cardiology program, probably because of some of the successes there and being able to garner some national prominence. I was then recruited to Detroit and with the purpose of being chief of pediatric cardiology at Children's Hospital of Michigan and a professor in the Department of Pediatrics. I also became vice chair of the Department of Pediatrics and ran the business operations for the department. This was my career goal. This was my large pediatric cardiology program. I had a postdoctoral fellowship program there. I had a large research program. I had 10 pediatric cardiologists with whom I worked and led. And there I was. And I woke up one morning and said, okay, what is next? Here I am leading my pediatric cardiology program. And because I'd been involved in a lot of other activities at the same time, I was asked to consider the role as Associate Dean for Clinical Affairs at Wayne State University and to be Chief Medical Officer for the Detroit Medical Center. And even though this was not in my roadmap for my career, I thought that this would be something that perhaps I'd like to do and that I could make an impact. So I moved into that position. And what's interesting, after a few years of doing this, while I remained Associate Dean for Clinical Affairs at Wayne State, I was then asked to become CEO of Sinai Hospital in Detroit, which at that time was about a 650-bed hospital with community clinics as well. And I ran this hospital for a period of time. So if you think about my career goals, this was nowhere on my radar. Again, always looking toward the future and other things I could do. When my younger of our two children was finishing high school, and we were getting tired of the cold weather in Detroit, I began to listen to offers to go back to warmer weather. And that's the time when we moved back to New Orleans, and I was asked to be Executive Vice President and Chief Academic Officer for this large integrated academic health system in New Orleans. Again, while I was in New Orleans, I also looked for other ways of innovating, of doing more. And that's when I was introduced to some people in Australia and developed a partnership with the University of Queensland University Medical School here in Brisbane, Australia, where I started a program over 10 years ago to admit US students into the medical school in Brisbane, where they'd spend their first 2 years and then come back to New Orleans for their final 2 years of medical school. And it was this activity probably that opened up the door that has given me the opportunity to be so involved around the world. And with that, I was recruited to Philadelphia to be in charge of ECFMG and FAIMER, as Dr. Montami mentioned earlier. And so I guess the message here is that with a career goal in clinical and academic pediatric cardiology, I wandered into healthcare management through a lot of different opportunities. And now I find myself heavily involved in a leadership role with global certification and accreditation of medical schools, which is so important in terms of improving medical education as well as healthcare delivery. And so, I guess the question is, how did all this come to pass? How did this happen? And I think it's important that a lot of different factors took place. One for sure was serendipity. And as I've defined on the slide for you all today, serendipity can be considered as the phenomenon of finding valuable or agreeable things that are not necessarily sought after. And I can look at my career on one hand as being very much influenced by serendipity, but also other factors as well. And I'd like to spend a few minutes now talking about some of those factors because, in our careers, looking at myself, in terms of the last phase of my career in senior roles, or maybe some of you who are just starting off and maybe still in medical school or in training, there always are lessons to learn. And particularly as physicians, we always have to look at ourselves as being in a leadership role, whether it's in a clinic area of taking care of patients, in a hospital, in an operating theater, in a catheterization laboratory. For me, as a pediatric cardiology, we need to always consider that we're leaders, and we need to learn about how to be good leaders. And we can't forget how important professionalism is. It's important in terms of caring for our patients, and it's important in terms of interpersonal activity, of how we interface with our coworkers and colleagues we see every day, colleagues around the world that perhaps we see just a few times a year, or maybe even less. That professionalism is very important. And as I think back, and there's 6 lessons that we're going to talk about, as I think back, the first lesson that is so important is that as a physician, we cannot have our careers be shaped by ourselves. We certainly contribute to it, and I had my master plan of being a pediatric cardiologist and leading a large academic pediatric cardiology program. But we have influencers, and they're always very important in our lives. And it's important to actually seek out mentors or at least role models, not expect that they're going to come to us. Sometimes that happens, and serendipity plays a role in that, but we need to seek them out. And I've had many mentors, more mentors than I can mention, and unfortunately probably than I can remember. But there are 4 that I want to share with you today. The first one, which really goes back to my early formative days and years as I was growing up, was one of my uncles, Ed Wallover, who was a surgeon in Cincinnati. I had the opportunity to spend a lot of time with his family. One of his 4 children, Bob, is the same age as I am, and so we spent a lot of time growing up together. Even though I grew up in Akron, they lived in Cincinnati. My family spent a lot of time in Cincinnati, and I was able to see how a family with a surgeon as the head of the family, how the family worked, and how the activities they did. And as I got older, actually in high school, I started to go to the hospital with my uncle, and actually went into the operating theater with him. I will tell you the very first time I almost passed out, not when he began the surgery, But when the anesthesiologist was putting a very large catheter, venous catheter into the patient. But having overcome that, I spent quite a bit of time, and my Uncle Ed was a wonderful role model for me. The second role model is Jim Donahoe. I met Dr. Donahoe in the first month. I can't remember if it was the first week, but certainly the first month of medical school back in 1969. There was a program at St. Louis University where medical students would spend, I think it was a couple hours a month in a physician's office. This was part of the community medicine activity in order to be able to understand what how a physician works in the community. And I was assigned to Dr. Donahoe. This is, the first serendipity lesson. Dr. Donahoe was a pediatrician that had a special interest in pediatric cardiology, and this goes back in the days when not all pediatric cardiologists, went through formal fellowship and were board certified. And I just thought he was an amazing person. So whenever when my rotation ended, whenever I had a spare moment, I would drive over to his office, spend some time with him, with his patients, or would join him in the pediatric cardiology clinic at Cardinal Glennon Hospital, which is part of St. Louis University. And as a freshman in medical school, I was seeing cardiology patients. And that's when I knew that I wanted to be a pediatric cardiologist. After medical school and going to Baylor, Texas Children's to do my fellowship or to do my residency, even as I was applying to my fellowship, I ran into Dr. Dan McNamara. Dr. McNamara was the chief of pediatric cardiology at Texas Children's. And he is the one that really set my image of what pediatric cardiology program should be. Dr. McNamara had trained at Johns Hopkins University in the early 50s with Helen Tossig. If any of you know any history on pediatric cardiology, Dr. Tossig is one of the women giants in medicine, and her contributions have just been wonderful. But he trained there also at the time that Dr. Denton Cooley was training in cardiac surgery, and so it was the emerging time of cardiology, heart surgery, and pediatric cardiology. And Dr. McNamara not only was a role model and a mentor and a counselor to me, he gave me opportunities. Fast forward to, not quite 10 years ago, probably about 7 or 8 years ago. And well, actually it's longer than that. It was 15 years ago. It's amazing. I'm thinking about the time. Is when I met Father Anthony DeConcilius. Father DeConcilius is a Catholic priest. He's a Holy Cross father. He has 2 PhDs, a PhD in psychology and a PhD in education. And I met him when he came to New Orleans to be the president of Our Lady of Holy Cross College. We had a relationship with the hospital system to train allied health professionals. And I met Father DeConcilius right after the Hurricane Katrina in New Orleans, and we bonded very quickly. And we shared something which I think is really important, and that's our interest in empathy, in helping individuals maximize their ability to be empathetic. And I'll talk about that a little bit later. Anyway, my point of talking about mentorship is that everybody will have the opportunity to have different types of mentors. And actually, some mentors can be negative mentors in terms of showing you how not to do things, which can help you be a better person and a better leader as well. The second, the second aspect is to really to be in charge of your career. It doesn't mean that serendipity doesn't play a role. It doesn't mean that you don't have the opportunities to allow things to happen. But it means that you really need to get out of your training and practice what you put into it. You have to put an effort into everything that you're doing. It'll make you more successful. It'll make you feel better. It'll enhance your well-being. And frankly, it gets you through difficult times. As I've mentioned earlier, we've all chosen a profession that requires lifelong learning. And we need to continue to do that. We need to seek out those opportunities. We need to find faculty who are willing to talk about different concepts we might have, theories, share their theories, innovation, new ideas, and continually to seek out new opportunities and experiences. That doesn't mean you have to do what I did in terms of moving around a country or around the world and sharing or to seek out new jobs and experiences. But you can do that even within where you're working. So for example, when I was in Michigan for 14 years, I probably had 5 or 6 different jobs there as I kept getting pulled in different directions. But you know, all of this allows you to enhance the experiences with patients and for patients, be involved in research, community service. You know, we as physicians have a huge opportunity to not only be impacting people in our professional lives, the things we're trained for in terms of being a physician, but also things that we can get active in the community to give back in other ways as well. And I mentioned empathy before. Another way to describe empathy is to describe it as pro-social behavior. All of us who go into medicine must have had, at least in the beginning, a strong inclination and desire for pro-social behavior. That means doing things for others, not just for ourselves. And so it's that innate tendency to want to help others, to bring comfort to others. And as physicians, as professionals in medicine, it is so important to be able to be mindful of our patients and their needs, and always to act as empathetically as possible. And unfortunately, in the past, and I can tell you the way I was brought up in medicine, in medical school and training in particular, the stress and the rigor in others' behaviors really can result in minimizing or diminishing our pro-social and empathetic capabilities. And so we as individuals need to actively protect that and maintain what we have, because again, it not only will benefit our patients, it benefits ourselves. In terms of how we feel and what we get out of the work that we do. The other part that I think has been under great stress recently is the issue in terms of our relationship with our community. You know, as I watched my Uncle Ed, you know, decades ago, I could see that he was a resource in the community. He was somebody that people looked up to in the community. And that was how physicians were viewed. And it's because there was this sort of unspoken social contract that physicians have had with the community. Unfortunately, over the last few decades, that social contract has moved to more of a commercial contract because of a lot of different things that have gone on in terms of how healthcare is funded and delivered. But that social contract is so important. And as I mentioned just a little bit ago, we can be so important in our communities as leaders, not just as physicians, but in other aspects of what we do. And we should always look for those kind of things to make those contributions. So we need to always also keep in mind that we're professionals, and keep in mind that professionalism is something that our community looks to us for, as well as our coworkers. You know, we're fortunate that we have specialized knowledge. We've developed skills, and we need, professionally, that means we need to commit to continually to improve upon those skills and that knowledge. We always have to be able to show our competency. We need to be reliable, find solutions for our patients. And most important is to never compromise our values. You can never go wrong in maintaining your values and your honesty and your integrity, no matter what the temptation is for shortcuts or to blur those issues. Respect your patients, respect your coworkers, and definitely respect yourself and respect your families. We always have to be accountable for our behavior. We're fortunate that in most societies, medicine is self-regulated, and to be able to continue to be self-regulated, we need to demonstrate that we do a good job for that. And there's an image that we have to project to our coworkers and our patients because they expect it. So finally, the last lesson, and this is going to tie together a few things that I talked about, is for your own self-fulfillment and your own well-being. Find a way to fulfill your passions within medicine, but perhaps you have a passion outside of medicine. Remember when I told you that, you know, if you asked me when I was 13 years old what I wanted to do when I grew up, and I said I'd want to be a race car driver. Well, I didn't quite get there, but I found a way to maintain that passion. And when I was 40 years old, I finally found a way to go to racing school, and I learned to drive open cockpit, open wheel, formula type race cars, small ones, not like Formula One with, you know, 700 or 800 horsepower. And I found out I could do it, not necessarily well, but I could do it. But I also, because of the people I met, I was able to start a foundation over 30 years ago, almost actually over 35 years ago, in Detroit, when I was living in Detroit, to use motorsports to promote the healthcare needs of children in children's hospitals. And so this program has worked over the years. Is I take race car drivers, mostly IndyCar drivers, to local children's hospitals to see the kids before they race for that weekend. And we raise money for children's hospitals as well. And so we've taken race car drivers to see kids all through the United States, Canada, Mexico, Australia, Japan. Haven't been to Doha, to Qatar yet, but other places, and that's sort of like my other life. And I know so many other people and have had so many experiences. In fact, here's a picture montage of when I raced in Long Beach, California, as part of a major IndyCar racing event. In what's called a pro celebrity race that my charity, Racing for Kids, have sponsored with Toyota for over 25 years. And you can see the race car that I drove, and these are the other drivers that raced with us, and we have a couple kids in the hospital and a check that we donated. So it is possible to combine your out-of-hospital passion with your in-hospital medical passions and have a good life. I'm going to pivot now because I want to be conscious of the time and leave time for questions and talk about how this career journey has brought me to this last phase of making an impact. and that's with the accreditation of medical schools around the world. And remember that accreditation is a process. It's like external quality assurance, where a designated authority can review and evaluate an educational institution like Qatar Cornell Wild, and be able to measure how that organization is performing based on a defined set of standards. Not to be critical of it, but as a way to improve, because again, continuous improvement is always important. And accreditation of medical schools is very important because there's so much variability around the world. And medicine is, like other professions, is globalized. Students go across borders for medical education, including to Qatar. Physicians go across borders to care for patients. Patients cross borders. And so there does need to be a set of standards against which all can be measured. Most importantly is that over the recent decades, there's been a huge increase, proliferation of medical schools. And over the last 20 years, almost a 70% increase in medical schools. And if we look at it from a region perspective, we can see that all regions, including Middle East and North Africa, have had an increase in medical schools. And who's paying attention to that? And how do we know that when a student is looking at a school, a prospective student, that it's going to meet the standards and that individual investment is going to result in a quality medical education? Because also there are people that try to take advantage of the opportunity of developing medical schools. And unfortunately, from a United States perspective, there are medical schools, particularly in the Caribbean region. There's some of those schools, not all. Some of those schools are not quite what they should be. And students, prospective students, need to be protected against that. And one way to do that is through demanding for accreditation. And so the board of ECFMG back in 2010 did a study and found that with this number of schools that has developed, that some schools really are not properly credentialed. A third of countries around the world do not have an accreditation program. When there is accreditation, it's not always mandatory. And there's significant variation of how everything is measured. And accrediting agencies differ in specific protocols. And this puts our whole premise of medicine being able to be self-regulated at risk. So the board of ECFMG said that effective in 2023, that individuals applying for ECFMG certification, this was the stick that ECFMG could put together or could carry, was requiring that graduates would only be considered if they graduated from a medical school that had been appropriately accredited by an agency that was recognized by doing a proper job. Now with the pandemic, we have moved this date to 2024 and are looking at that carefully. But this, in effect, has been the stick that is allowing to improve medical education. It is stimulating international accreditation efforts, even in countries where graduates have no interest in coming to the United States. Because by promoting this universally accepted standards of evaluating undergraduate medical education, it is enhancing the quality of medical education, which means we're assuring the public, protecting the public, that their caregivers will have been properly educated. Now, ECFMG is not doing this accreditation. What we've done is we've sort of developed that concept and the idea for that. And because there's no way that ECFMG could accredit the over 3,000 medical schools around the world, nor could ECFMG even accredit or recognize the accrediting agencies around the world, but WIFME can. This is the World Federation of Medical Education, which is based outside of Geneva, Switzerland, and was initially established by the World Health Organization. And WFME is now leading an international program of recognizing accrediting agencies for medical schools that will meet standards that all countries will recognize. And it's this accreditation process that will allow us to assure the public. And it will assure the public because WFME has established this meaningful recognition program and be able to recognize the accrediting agencies in each country, which will then do a proper job of accrediting medical schools. And then from an ECFMG perspective, allows individuals to be eligible for ECFMG certification. So to date, we have over 23 accrediting agencies recognized by the WFME. Many others are in process and in queue, and the pandemic has slowed this down to some degree. But the response to this initiative demonstrates how important everybody really feels this commitment to quality improvement is. Remember, accreditation is not a punitive activity. It is a commitment to quality improvement. While we recognize that many countries have had to suspend or limit their accreditation efforts during COVID, which is why I mentioned earlier that we've pushed this now to 2024, and we may change that again if it's necessary. I've had many interactions around the world and been invited to visit many places pre-pandemic. And I can tell you that this accreditation process is very well recognized and is seen as the future. The accreditation is the future for quality assurance of medical education. And there's this general agreement that global standards are needed. And as I mentioned also, many countries, accrediting agencies want to be recognized, even if they don't send individuals here. At the end of the day, what we're talking about is that better education leads to better patient care. So I've had this journey, this professional life that has taken me into very many different situations. And although I started off with a career goal of being an academic pediatric cardiologist, I now find myself being able to leave a legacy of better education and better patient care. And at this point, I think I will stop.
On behalf of Dean Sheikh and the entire school, Bill, thank you so much for taking the time to be with us this evening. It's morning for you, but evening for us. And again, we cannot thank you enough. So really appreciate it, and thank you so much.